transport across capillary wall. The small vessels in the vasculature, arterioles, venules, capillaries, embedded within organs, responsible for the distribution of blood within the tissues. There are three types of capillaries. 1. Continuous endothelial cells provide uninterrupted lining. Permits passage of small molecules, muscle, brain. 2. Fenestrated have pores in cytoplasm of endothelial cells, permits passage of larger molecules, kidneys. 3. Sinusoidal, discontinuous type of fenestrated capillaries, larger openings in endothelium, permits passage of even larger molecules, liver. The three types of capillaries are displayed, as in here. 1. Diffusion. Diffusion is bidirectional and its net movement is governed by concentration gradient. Moreover, the Starling forces are not involved in diffusion. 2. Filtration fluid movement can be either inwards or outwards, but not both. Its net movement is governed by the balance of the hydrostatic and oncotic pressure gradients, the Starling forces. What are Starling's forces? The hydrostatic and oncotic pressures acting across a capillary wall, causing movement of fluid across it, is called Starling's forces. Hydrostatic pressure. It is the pressure exerted by a fluid when it is at rest. Pushing force, a fluid out of capillaries. Oncotic pressure. The pressure exerted by the small, non-diffusible particles suspended in the fluid within a vessel, i.e. albumin, pulling force, of fluid into the capillaries. Look at third illustration. Whenever hydrostatic pressure is greater than oncotic pressure, fluid will leave the capillaries. Whenever the oncotic pressure is greater than the hydrostatic pressure, fluid will enter the capillaries. If hydrostatic greater fluid exit, if oncotic greater fluid enter. The Starling's equation. Fluid movement is equal to capillary filtration equation, into difference between capillary and interstitial hydrostatic pressures, minus difference between plasma and interstitial oncotic pressure. So, the net movement across a capillary can be determined as in Neola. At T arteriolar end there'll be filtration, and at venular end there'll be absorption. There are 4 points that you should remember. Approximately 24 liters of fluid is filtered through the capillary walls in the body per day. Almost all protein is retained within the vessel. Only approximately 85% of the filtered fluid is reabsorbed at the venular end. The balance 15% returns to the circulation via the lymphatic system. We'll come to an MCQ point. The amount of fluid in interstitium depends on capillary hydrostatic pressure, interstitial hydrostatic pressure, oncotic pressure, capillary filtration, coefficient number of active capillaries, lymph flow and total ECF volume. Edema. Edema is the accumulation of fluid in the interstitial fluids in large amounts. Pathophysiology of edema. Edema fluid can be accumulated in the subcutaneous tissue because of the laxity of the subcutaneous tissue. Progressive weight gain is a good early sign of edema. Pitting edema is a late sign of edema, usually due to accumulation of more than 3 liters of edema fluid. Localized edema occurs if this balance is disturbed, as seen in TREPI 1. Obstruction. Examples are obstruction of lymph flow in filariasis, veins in pregnancy. 2. Inflammatory causes such as bee sting, insect bite allergy. Generalized edema is caused by 2 things. 1. Increased hydrostatic pressure within circulation. 2. Reduction of plasma protein level. 1. Increased filtration pressure seen in arteriolar dilatation equals venular constriction and increased venous pressure. Decreased osmotic pressure gradient across capillary is seen with decreased plasma protein levels as in nephrotic syndrome, liver disease, burns, malnutrition. We'll take a question. What causes edema due to hypoproteinemia? 1. Malnutrition. Edema due to down-pointing arrow dietary protein intake. 2. Hepatic edema due to down-pointing arrow synthesis of albumin in the liver. 3. Nephrotic syndrome due to up-pointing arrow loss of protein in the urine. 4. Protein-losing enteropathy due to up-pointing arrow loss of protein from the intestine. Look at these pics. Edema seen in protein energy malnutrition, kwashiorkor. Periorbital edema seen in nephrotic syndrome. Increased capillary permeability is seen in burns, allergy, are mainly due to release of vasoactive substances such as substance P, histamine and kinins. Edema due to lymphatic obstruction is called lymphedema. Seen in filariasis, radical mastectomy congenital, rare. Look at these pictures. Lymphedema of upper limb following. Right radical mastectom. Elephantiasis seen in filariasis. Thank you for listening.